Welcome to today's discussion on Se7en. Where would you like to start? Student's choice.
Low-hanging fruit, the serial killer.
Sure. So John Doe, what did he say?
It seemed he felt very morally justified that he was the only one that could really set the world straight for the 7 deadly sins. So I found that kind of fascinating that he it was almost like a grandiose behavior. And that he also did very methodically, right? He followed each one, he followed all 7 deadly sins, very meticulously planned out how this was going to play out and kind of almost predicted the emotions of somebody else in order to get that end goal, the wrath and the envy.
Okay.
So he had other people play out in his, I don't want to say delusion, but what his reality was.
Gotcha. All right. 3 things that you said probably require just a little bit more in-depth conversation and analysis. Number 1 is grandiosity. It seems to certainly be motivating his behavior. Can anyone develop a differential diagnosis for clinically significant grandiosity?
Well, one, probably not in this case, but narcissistic personality disorder.
Yeah. So I think it's very fair. And I'm not so sure that he doesn't meet criteria for that personality disorder, right? One of the kind of cool things here is that he adopts envy as his deadly sin. Envy just so happens to be a diagnostic criteria of the personality disorder. So the deadly sin is actually published in the DSM.
And also just even further in support, when he was in the back of the cop car driving to the end, he said, he was saying about his legacy, he kept saying oh, my legacy, he keeps focusing on bringing that back, which is a very big characteristic of a narcissistic personality.
Yep.
So I don't think he quite meets the criteria for schizophrenia either, but this idea of, communicating with the divine power or, having control over things in a way that regular humans don't, I think that also that does fall under that bucket.
Yeah, so in a situation like this, where if we were able to provide further assessment and we were able to rule out against a perceptual disturbance, like an auditory hallucination or hallucinations in general, or even disorganization of thinking, thought process, speech, because he seems fairly articulate, and with those being investigated and ruled out, not likely to be schizophrenia, what does that leave us with, potentially? Continuing with that line of thought.
Would it be delusional disorder?
Yeah. So what are the 5 subtypes of delusional disorder? I'll start you guys off. Grandiose type is one of them.
Persecutory.
2.
Is it romantic?
3, rhodomanic.
Is there paranoid?
That's persecutory. 2 more.
Paranoid.
So I said, okay.
How great would it have been if I said yes? I'm not that quick this afternoon. 2 more. I think. Jealous type and somatic type. All right. So the acronym is JPEGs. All right. Jealous, persecutory, rhodomanic, grandiose, and somatic. And he might actually be delusional disorder, grandiose type. Right. In the absence of those cognitive deficits, disorganization, that would otherwise be defining of schizophrenia. I think one more biggie in terms of our differential here for clinically significant grandiosity.
Would it be antisocial personality?
Less likely so. Listen, I'm not arguing with you there. He absolutely embodies a blatant disregard for and violation of others' rights. No doubt about that. He's ruling in here. We want to make sure that there's evidence of conduct prior to the age of 15 to make the true diagnosis, but I think the grandiosity for the personality disorders weighing more towards narcissism.
Is it borderline personality?
Similarly, not a lot of grandiosity there.
Okay.
Bipolar.
Yeah, mania and therefore bipolar 1. Yeah, so I think that's our differential there. He's also very meticulous. That's the other word you used. Can we generate a differential here?
OCD?
Yeah. Yeah, I would start off with obsessive compulsive personality disorder as well. Somebody give me the signs and symptoms that would be characteristic, if not the DSM criteria defining OCPD.
It's a pattern of obsessive and compulsive behaviors.
No, isn't it like you're very like methodical, but it doesn't affect your daily functioning, and it's not gonna, because it's no pathology, it's not pathologically affecting you, but you're very.
Intrusive thoughts.
Is it like perfectionism?
That's it. Yeah, it's your type A personality. It's a misnomer. There is no evidence of intrusive thoughts or obsessions or compulsive behaviors as part of this definition. That's OCD. OCPD, a little bit of a misnomer in terms of how it's initially misleading. Think the type A personality. Think the micromanager, the attention to detail, the perfectionism. That's OCPD. That's what we see here. Yeah. So we'll get in another day why the APA psychiatry named this personality disorder so similar to OCD, because it really does serve to confuse. For now, let's just focus on, pardon the pun, OCD, that anxiety disorder, the title itself containing the DSM criteria. Very simple. Individuals with clinically significant obsessions and or compulsions, that's OCD. Those terms are nowhere outside of the title of obsessive compulsive personality. Right? When you actually look at the DSM definition, it's your perfectionist, your perfectionist, right? The person who works at the expense of leisure, the attention to detail. People are miserly and frugal. They're stubborn when it comes to issues pertaining to morality and ethics, right? Type A personality. Right? That's him, right? So I think that begins our differential here. I'm not even sure it goes much beyond that, which is interesting because if he's not manic and if he is not delusional, and we think that his grandiosity may be more consistent with narcissistic personality, he's got a cluster B as well as C personality disorder, because he does have, at least on face value, OCPD as well. I'm not ruling out, he's definitely antisocial as well. So he's got 3 already. All right. And let's stick with this idea of antisocial personality disorder, because he also is able to predict the emotions of others. I think that's the word you used. What's that about?
Manipulation, like he has a desire to, he's kind of put himself in the center of this giant delusion, right? That he's the person who is going to be calling out the 7 deadly sins in like the world, and whatever, and he's inserted himself as like the orchestrator of this plan, but also like a victim. It's really interesting. And it makes you think that, maybe he also he needs to make the world pay, but he also needs to make himself pay. It's like this weird, like, masochistic, like, interesting thing. I forget what point I was trying to make in the beginning. Yeah.
His level of manipulation, though, has this almost, again, predictability. If he is unsuccessful in predicting this behavior, if Mills doesn't pull the trigger, his legacy is ruined, which is a big deal for a narcissist, right? That's what your point you made. So talk to me a little bit more about his being able to predict emotions of others.
I would say he has like he has insight into other people's minds. Like even though he has these like delusions, he's still able to really understand other people's perspective, which allows him to be cunning and manipulative.
That's exactly right. So what is that called? Yeah, more in a psychological terms. It's going to seem weird when you say it or when I say it, but it's true. He's empathetic. That's empathy. Yes, he is. He's not compassionate. That's different, right? But he is empathetic. And without that empathy, he wouldn't be nearly as an astute serial killer. Right? But he's able to see things, events, through the perspective of others. And his knowing that so-and-so will pull the trigger, so-and-so will do this, allows him to carry through his plan. He's empathetic. All right. Now, the reason why I bring this up is because I want to talk a little bit about antisocial personality. What if John Doe, upon clinical investigation, demonstrated no signs or symptoms suggestive of a conduct disorder prior to the age of 15, and therefore he escapes the diagnosis? What then?
You could still technically qualify, right? Because
No, you can't. You need the conduct disorder.
I mean, can you imagine coming out of this patient's room and looking your attending in the eye and saying, I don't think he has antisocial personality? I mean, I know it's early in your clerkship and you have time to make that up, but that's a big pitfall right there, right? That doesn't feel right at all, but it is right.
Interesting.
And your attending is going to call you on it. Like, if not that, what? What are we dealing with here? What are we dealing with here? What's the clinical term that is likely to be used here? That's it. Psychopathy. Yeah. Yeah. Now again, there's not consensus or total consensus on these terms now, because you've gone from an actual illness, a sickness called antisocial personality disorder. It actually is a published disorder, and therefore you can treat it. Now we're dealing with a clinical term, not a disorder, psychopathy. Right? Now, I think to start this conversation, psychopathy is generally identified as just a more severe form of antisocial personality disorder. Right? So individuals, and again, with all due respect to the DSM and the provision of conduct to make the diagnosis, for all intents and purposes, all individuals with psychopathy, all psychopaths, are going to have traits of antisocial personality and even meet full definition without the evidence of conduct. On the other hand, not everybody with antisocial personality is also a psychopath. So that's one way to kind of begin to think about this concept. Right. Now, if you want to get into this even more, those other traits that allow you to say psychopathy, even if they rule in for antisocial personality, and you could say and psychopathy, are items that are taken from the HARE, HARE, psychopathy inventory. Right, so that's a bedside test. It's an objective clinical assessment that allows you to diagnose psychopathy, or at least render the clinical term. And if you look at it, there's a lot of overlap with antisocial personality, but those additional symptoms are narcissism. That's if I could just give you a broad stroke, it's narcissism. That's what we might be dealing with here. Now, what's even less, or where there's even less consensus, is this more this other term that really comes from sociology, not psychology or psychiatry, and that's sociopathy, right? So that's easy to remember: sociopathy, sociology, right? So psychiatrists really embrace the term psychopathy, less so sociopath or sociopathy, but in this context, what is the one thing that does help differentiate, if anything? And again, there's not a lot of consensus here. I've done more than one literature search on this, come out with more questions than I do answers. But there's one thing that is fairly consistent in the literature that help tease out sociopathy from psychopathy. Anybody have any idea what it is?
Violence.
Is it like?
It's the quality of violence. I'll give you that.
Is it like how they present to like other people, like relationships?
Why?
Because like sociopaths show that they're like angry, like easily angered, like kind of hard to get along with, whereas like psychopaths, they are generally like well liked and they're able to like carry themselves. Or yeah, backwards.
Yeah. Why? Why is that? That's true.
Because psychopaths are deceitful, like it's like the front that they put on. Like sociopaths more like emotionally targeted and attacking. Psychopaths want to like get in and like do and invoke like the damage like subconsciously.
And how are they able to do that?
With the empathy.
That's it. That's it. Yeah, that's the general consensus, and again, it's not very well teased out in the literature, but that does come up again and again and again. Right? Psychopaths are usually described as having ice in their veins, doll's eyes, dead eyes, And again, there's certainly exceptions to the rules, but general concept is that they harm people from both a physical and emotional, especially emotional distance, because they lack the empathy. Right. So think serial snipers, serial bombers. Right. On the other hand, that's psychopathy. Sociopathy with empathy, they do tend to harm others from more of a close emotional and physical distance. Right. Again, clearly exceptions to the rule, right? Because this has not been very well teased out in literature. Right. John Doe with empathy, spending a year with a victim, is more of a sociopath. Yeah. Any questions on that?
I have a question with the antisocial personality. Is it they have to be diagnosed before 15? Or, like, I guess what I'm trying to say is, like, could you make the argument if someone hasn't been diagnosed before 15 but they've never been analyzed by a psychiatrist, could they still? Okay.
Yeah. Yeah. If there's evidence of conduct, they don't have to. They definitely do not have to have an established diagnosis. But if the astute clinician asks, if the information's there, you still diagnose antisocial personality if it's there. Yep.
I know we were kind of teasing out psychopathy, sociopathy, and all these different terms. I don't know if it's appropriate to ask this, but the difference between DMD and ODD and all these in conduct and antisocial. Is it possible to quickly talk about that, or is that not possible? Just because I feel like the lines are always so blurred, and just I get so confused on all the different terms.
Yeah, I mean, I'm the wrong person to talk about when it comes to conduct disorder versus oppositional defiant disorder. But ODD certainly, again, is a condition where the definition is in the title. There'll be multiple aspects or examples of the individual, usually the child, being oppositional and defiant. Conduct, again, is considered to be a more severe form of that, where you actually have destruction of property, where you actually can have cruelty to animals, as well as the overlap symptoms with ODD, which includes the resistance to authority figures. But that's the general idea, and that's why we, again, in forensic psychiatry, you hear about the psychopathic triad: fire setting, cruelty to animals, and bedwetting. Right? Bedwetting's the third of that triad that comes from left field, but it's consistent in literature.
Is there any protocol that they found out there where if you can identify psychopathic or sociopathic traits in the child or the young adult, any sort of intense protocol therapy where you can fix them?
Yeah, I mean, I think putting together, again, a biopsychosocial treatment plan, the earlier the better, is certainly going to result in a better prognosis than otherwise. If you're looking for that magic bullet, borderline equals DBT, no, we don't. No, not in this case. But certainly a nurturing family and support system, assessment for any co-occurring conditions, anxiety disorders, post-traumatic stress disorder, depressive disorders, and then treatment of that. Certainly, is going to confer to a much better prognosis. But I don't have a single answer for you now. Any other thoughts on John Doe?
I was a little confused. I understand his desire for grandiosity, but I almost think if it was delusional disorder or if it wasn't, what was he really trying to accomplish? Because I'm trying to figure out his intent beyond this grandiosity and legacy. So that was just confusing to me. Trying to understand.
I'm not sure there's much beyond his legacy that he's intended here. I think that's a big part of what's going on here. I'm not sure there's a whole bunch more there. I mean, it's just like John Kramer, same first name, right? From Jigsaw and the Saw franchise. I mean, now where Kramer, I think, as soon as was it Saw 3, maybe even Saw 4, where we kind of get the history as to what happened and why he does what he does. We don't get that. I think we have the trigger, the precipitant, where he vomited on somebody in the subway, but we really don't have that teased out history as straightforward as we do with John Kramer. So I don't want to derail. We only have a couple minutes left. So
So if you have like a metabolic cause of psychosis, like something like Wilson's disease, can that to some degree like mimic very closely one of these disorders that you've described, or are those generally a little bit more a bit of this, a bit of that, not super coherent?
it could mimic, especially on shelf exams.
Mhm.
All right, and I think the atypical feature that should get the test taker to think, something else going on here, is the rapid onset of the behavioral change.
Mhm.
And 9 times out of 10, the single best answer is prion disease, with its predilection for the frontal lobe. And again, get back to John Kramer, who has a glioblastoma in his frontal lobe. Yes, but rapidly progressive personality change, acute personality change, that's very atypical. It's not due to a personality disorder, which again, many of us think is established, teenage years, early adulthood. In that case, yes. Think frontal lobe pathology, seizure, tumor, prion disease. 5 or so minutes left. 5 to 8 minutes left.
I would address just maybe the feelings it was really messed up at the whole ending in the movie with the head and everything. So maybe some of the emotions, looking at it from a psychiatrist's perspective of I forgot his name, but the main character who actually shot him, what was going through, if there are any medical terms related to that.
Well, I think there's a lot going on with Mills, including what happens at the very end of this movie. I think given the trauma that he experienced at the end of this movie, it's more than enough to make sense of his behavior. However, having said that, I also believe that this particular character is significantly predisposed, and John Doe knew that. And that level of predisposition has everything to do about how maladaptive his relationship is with his wife. I mean, that relationship is so distant that he doesn't even confide in her when he buys the apartment. There's no way you can tell me that she had any input in their moving in the first place. He has totally written her out of his life, and she's come to the conclusion that she's going to do the same, because when she gets pregnant, she only tells Somerset, not even her own husband. And that's as a result of the years of neglect that she's endured in this relationship. And John Doe somehow, some way understands all that. While I think the precipitant of what happens at the end of this movie is more than enough to explain the behavior that we see, that doesn't mean that there's not a significant predisposing element to this. And those predisposing elements certainly start with his marriage. And does that fully answer your question?
Yeah, it does.
Yes, he's a very flawed character, this Detective Mills. Yeah. But again, he would have to be flawed because we need him John Doe needs him to ensure his legacy in carrying out that final sin. He needs to be wrath.
And even I was thinking, I know it may be a little bit of a jump, but he's PTSD characteristics too in some ways. We don't have the nightmarish because we don't get that insight, but he's very hyper aroused. He's got all similar symptoms.
Yeah, I mean, I actually think that, and the more and more we discuss this film, and the more and more I assign this film, he does appear to have features consistent with borderline personality disorder. Right? I mean, wrath/anger is actually written in the DSM criteria here, and that happens to be his deadly sin.
And in his relationship with his wife too, this he has these points where he's very affectionate, and then he'll just switch it on and off, just sort of as he sees.
He's a
fit.
splitter. He is. Yeah. Again, he's impulsive, which again he has to be. So the onset of anger has to be rapid, because if it's not, Doe's not going to be able to fulfill his legacy. So the fact that he has 2 criteria for borderline is necessary for him to be that 7th and final sin.
So, at what point do you consider it to be a disorder versus something that's an attachment style, an avoidant or a dismissive avoidant attachment style, as opposed to borderline personality.
Yeah, when two things. Number one, quantitatively, when you actually reach 5 full criteria defining borderline, number one. And number two, qualitatively, when all of the above result in clinically significant distress or impairment in others. And he's got pretty significant impairment. Again, I'll start interpersonal, but there might be even more than that.
Okay.
Yeah, this is less fun, but then like with Somerset also, I feel like he did tick off several MDD criteria. With the insomnia, the anhedonia, generally depressive.
You're right. I think right. Yeah. First glance, there's 3 right there. Yeah. Yeah. I agree with you.
What about the wife was having adjustment disorder, but now that it makes sense that she had neglect from her husband, maybe not so much.
Yeah, I mean, there might be adjustment there, but I think it's adjustment superimposed on a more chronic condition.
Yeah.
Yeah. All right, we're at the bottom of the hour. Any final thoughts? David Fincher, 7. We're good. All right, we'll leave it here. Sign off.